Are pesky skin tags causing you frustration? Say goodbye to those nuisances with our expert guide. In this video, we unveil the dermatologist-approved secrets to treating skin tags right from the comfort of your home. No more costly visits or invasive procedures, just simple, effective techniques that'll leave your skin looking flawless. Ready to reclaim smooth, clear skin? Let's dive in and banish those skin tags for good. This video covers everything related to skin tags. Okay, here we go. So, what are skin tags? They're also known as acrochordons, and these small fleshy growths can appear anywhere, including the eyelids, where we see them all the time. And don't think you're going through this alone. Trust us, everyone understands. It's just a part of life. What really causes skin tags? Three main things. One possibility is that you are simply genetically predisposed to these traits. But there are also other important things going on in your life, such as friction. So, friction is probably one of the leading causes here. This is anything that rubs up against your skin. That's why you often see them on the neck, where your necklace or clothing rubs up against you, or in the groin, armpits, where there's a lot of friction from movements and skin on skin. So, friction number 1 and number 2, you can develop metabolic syndrome. So, metabolic syndrome, obesity, and other factors that increase insulin-like growth factor can all promote the formation of acrochordons or skin tags, correct? Skin tags are one of the early changes you'll notice. This can actually come before some of the other objective changes because insulin is an anabolic hormone, which means it promotes growth. And so, simply being resistant to that, having higher levels of circulating insulin, which is an early change, can lead to the growth of these, as well as other things, such as acanthosis nigricans, which is a dark pigmented patch and plaque on the neck under the arms. It most likely has the same physiology, or at least contributing causes. Okay, now that we know what causes them, let's talk about how to prevent them. Essentially, you try to reverse the costs that you cannot change by reducing friction. This includes not wearing high-colored shirts that rub against you, not wearing ties all the time, not wearing a necklace, and wearing loose-fitting clothing on the body. These lifestyle changes can be very beneficial. You can also improve your overall metabolic health. So, lowering insulin levels requires lowering carbohydrate intake. These can reduce the insulin-like growth factors that contribute to it. So, changing your lifestyle can definitely help prevent these. But once they've formed, as I have one right now, even if I improve my metabolic health, it won't get rid of the existing skin tag. You'll still have to remove that. It'll just keep future ones from happening, which is a major source of frustration because you can do a lot of things correctly but still have these. So, naturally, people are searching all over the internet, all over the library. Nah, I'm just kidding, no one goes to the library. But, everyone is looking for ways to get rid of them, which is understandable. But first, let's look at some common home hacks that we see on social media and from patients in the office. So, if you've been on social media for as long as I have, you've come across a million hacks. I've even seen Facebook ads for products like this. People are taking dental floss and tying it around it to make it fall off, which is an old trick that people's parents will tell you. The other one, shown in the intro video, shoots a rubber band at it, which then strangulates the lesion. And then there are various topical potions that people apply to these. So far, I've seen apple cider vinegar, high concentrations of salicylic acid, tea tree oil, and black sap. So, I'm going to divide this into two categories for you. All of the destructive caustic methods, such as southwest acid and black salve, which you have, and apple cider vinegar, which is currently my least favorite skin ingredient. All of that exists on one side, and it has the disadvantage of destroying and damaging all surrounding tissue. The consequences can be severe and visible. We see this in literature and in real life. However, the second arm of it is a string or rubber band. If you tie it around the stalk, it causes very little damage to the surrounding skin. If you only do one thing, that's probably the best choice. However, there is a drawback to diagnosis because there are many things that can appear to be skin tags but are not. Here's a cautionary tale. As dermatologists, we always have to give you the worst case scenario. Why? Because we see the worst case scenario. So I'll present two worst case scenarios. One, if you decide, okay, I want to tie one of these things off or use one of these rubber band devices, which, by the way, if you go back and watch that video, whatever was on there, they glued onto the skin, so that wasn't even a legitimate video. I'm not sure what that was, but the rubber band technique certainly could work if tight enough. Two cautionary tales. One, as Dr. Maxfield mentioned, the diagnostic component is critical. Is what you're removing something you should be removing? So, I've seen this happen a lot on the face where people remove a mole at home and it turns out to be a skin cancer that should have been diagnosed. Instead, they removed it, it had roots, and the roots spread to other areas. Right? You want to make sure you know what you're removing before you do it, so that's cautionary tale number one. Cautionary tale number two, with these disclaimers, is that I have seen a patient attempt to tie something off at home. So when they came in, they had a keloid on top of their ear from a cartilage piercing, which was a large keloid. It was pedunculated, indicating that it had a stalk. They then decided to tie it off with some dental floss after seeing someone do it on social media. They tie it off, and guess what? It does not fall off, but the tissue dies while still attached to the body. And any necrotic tissue attached to the body is highly susceptible to infection. As a result, it becomes infected, which spreads to the entire ear and face. So, despite her best efforts to save money, she ended up in the hospital, in the emergency room, on antibiotics, and with a necrotic keloid attached to her ear. Then she comes into my office for an emergency visit. I end up having to cut off the entire lesion. As a result, she ended up paying 3 or 4 times more than she would have if she had come in the first place. Now that we know how expensive medical care is and how difficult it is to obtain, we completely understand. The cost of medical care is ridiculous, but just be cautious. You'll be doing these things at home because we honestly don't want you to be harmed. Believe me, we feel you. These things are numerous, and everyone gets them. I understand your frustration. It's real. Keloids may be mistaken for skin tags, but there is a long list of other things that can resemble skin tags. So, it could be a neurofibroma, a cherry-angioma, a type of skin cancer, squamous cell skin cancer, keratoacanthoma, a pyogenic granuloma, nevus, lipoma, or nevus lipomatosis. Wow, nevus lipomatosis, I knew this one, Linitis lipomatosis, jealousy, I say it all the time. This is similar to a large benign skin tag, but there is another important factor to consider. Skin tags can be associated with syndromes, which relates back to the genetic component. So, if you have a very young individual, especially a child, who's developing multiple skin tags, especially in unusual areas, that's actually something your dermatologist might pick up on because, again, there are some syndromes with associated additional whole health things that can present with multiple skin tags early on, so that's just something else to keep an eye on. But that's what we're here to think about is like, oh, what else can be going on? That's why we're. So now that we've done our giant disclaimer, let's talk about how we treat them in the office, which I actually enjoy doing because it's similar to the milia for me in that I get to simply remove them and know that they're gone, which makes me very happy. So there are 2 main methods for removing them in the office: cryotherapy, which uses liquid nitrogen to freeze them. Now you can just point the liquid cryogun at the lesion and shoot it, and sometimes that causes some injury to the surrounding tissue because normal skin is going to be affected when that spray, even if you're pretty precise with it, or like Dr. Patel is doing in this video, you can actually dip these little like claw-like things into some liquid nitrogen, get the tips really cold, freeze the lesion, and then it doesn't cause as much damage. to the surrounding tissue, but then how? Thank you. So, once you've had a skin tag or any other lesion removed, you should make sure to care for it. The common belief is that you should let these things dry out. However, during the healing process, you should keep these things moist. That means applying Vaseline to the lesion until it heals. If you're concerned about scarring, you could try Scar Gel with a silicone base, which could be extremely beneficial to the healing process. Also, when removing a lesion, especially on the face, make sure to wear sunscreen. During the healing process, you are highly susceptible to hyperpigmentation, so sunscreen is a must in sun-exposed areas. One last piece of advice we can give you, based on our own experience, is that when you go to see a dermatologist about your skin tags, tell them how important they are to you. Let them know you're there for treatment, not just reassurance that they're fine. That is actually a very important step. The second issue is that it is not covered by insurance. For the majority of people, your dermatologist will most likely charge you a cosmetic fee. So, don't go in thinking it will be covered. Maintain the appropriate mindset and expectations. If you go to the dermatologist's office and they say it isn't covered, that's pretty normal. If they try to bill for it, the insurance company will typically reject the bill. Depending on your insurance, they may cover it, but it is often rejected. Cosmetic fees can range from $50 to $200, depending on where you are and how many you need removed. If you have a lot of skin tags, it will cost more, but the price ranges from $50 to $200, depending on where you are and how many you want removed. That is basically it. We've gone over what a skin tag is, how to care for it, and the best way to have it treated. We showed you how to care for it. There is currently one less skin tag in the world. But, as a cautionary tale, I have seen some bad cases, so be cautious. Thank you all very much. Please like, comment, and subscribe, and we'll see you at the next one.